All right, so let's say you're dealing with pain in the back of your hip or SI joint area or glute area. So anywhere around here, maybe even a little bit higher up into here, or even down a little bit into here. Here are some things that you can try to see if you can get relief and start moving in the right direction. The first thing we need to do is before we test any exercise, we need to set a baseline, something to compare the before and after to, because you can't just rely on your symptoms. A stretch that feels good for the muscle may irritate the joint, and a stretch or an exercise that feels like it's doing nothing could be exactly what you need. So we need to test your movement response. The first thing that you can do is bend forward like this, trying to go as low as you can to touch the floor. But you want to monitor your symptoms during this. So for example, let's say you're bending down and you're sliding down, and when your hands get to your knees, let's say you can feel it there. Well, then you're going to make a note of that, and that's going to be your baseline. Of course, you can test other things as well. You can test a single leg stand from the affected side versus the non-affected side. You could test going up the stairs, you can test running, you could test jumping. We're gonna keep it simple. We're gonna test just bending forward. Most important thing to test, especially if you're having pain in the back of your hip or side of your hip, is to test spine extension first, doing a set of these, and then testing your baseline again. Are you going further down before you're feeling the pain? Are you not able to go as far before the pain starts? Or is it feeling about the same? And using that as a gauge, and then if it's feeling the same or better, doing more to see if you can get a positive effect. If you do 2 to 3 sets of that and it feels like it's not doing anything, then you move on to the next exercise. A variation of that often helps is bringing the affected side up. So if it was my right side, I would bring my right leg up here and I would do my press ups this way. And you want to feel that load and compress this right side lower back. And so a lot of the times loading and compressing these joints rather than stretching and gapping them has a better and faster effect. Of course, if any of these exercises feel painful to do, sharp or uncomfortable, or get more uncomfortable with more reps, then don't push through anything. Any exercise, if it's going to be good for you, should feel like it gets easier to do with more reps or have a positive effect on your baseline. And so next, what else can we try? Let's say maybe doing those extension-based exercises felt uncomfortable. We could do a knee to chest exercise instead, and we could compare this, again, seeing if that's any better. We can test seated or lying down glute stretches. Again, always testing your baseline to see if it's better, worse, or about the same. And you could test trigger point release, either into the lower back on that side, the upper glute on that side, or deeper glute on that side. Start by just testing those things, see if something resonates with your body. If not, let me know, and maybe I can help you with some other ideas. And if you feel stuck, you know where to find me.